did, I came late, but I didn't even know it started at 5:30. But the thing that I think I remember is that she just said they have distorted body imaging when they are bulimic or anorexic.
No, that's a good one, that's a good one. And so distorted body image kind of goes on to what we're talking about. So you think that you can think of that as a thought disorder, because if people do have severe anorexia, typically what you get hospitalized more or take inpatient treatment for the bulimia.
Below 17B.
They have severe body
Fuck.
dysmorphia, which can lead to these thought disorders we're
That's a
talking
skinny
about.
woman.
So schizophrenia spectrum is actually a spectrum of disorders. So we think of people really having severe schizophrenia and doing a lot of aberrant behaviors. But they're like anything, there's a spectrum of it. We're teaching you kind of textbook things, worst case scenario. But there's people who are living successfully with illness, but sadly, you don't see them a lot because we see them when they're going to seek treatment at an exacerbation. So, and then our usual objectives. Oh, thanks, they're in the middle, right next to the straw and the pencil. I don't know why I have that configuration. So, concepts, types, schizophrenia versus other disorders. Symptoms are big, so I'll say this a million times. There's positive symptoms, negative, cognitive, and affective symptoms in schizophrenia. Then, of course, we're going to inject the nursing process. There's a lot about medications. So, of the DSM-5, there's a spectrum of schizophrenia disorders. The mildest being, in personality disorders, which we will, get to. And personality disorders are things like borderline personality. And if somebody's really a lying snake, really psychologically, they could have borderline personality disorder. So, things that we think of, we know people like this. We all know people with all these disorders. It's just when it gets to be extreme that it's diagnosed as a big mental illness. And then you can have a brief psychotic disorder. So that can just be one episode, unfortunately. You can have, commonly, where I work, we have substance-induced psychotic disorders. So there's high offenders. Can anybody think of one high offender of somebody getting psychotic?
Like alcohol psychosis.
Well, alcohol psychosis due to withdrawal, that's a little different.
Okay.
I mean, people can get psychotic from alcohol.
PCP, Flocka.
Yeah, PCP, Flocka,
Oh, sorry.
K2.
Sorry.
No, that's okay. K2 is a big one. Ketamine, special K. So things like that, like hallucinogenic drugs, give people the drug-induced psychosis. Then it's commonly, in a lot of, when you're on your inpatient units, you'll probably see people with schizoaffective disorder. So that means they have predominantly a thought disorder, but an underlying mood disorder. So, because I always wonder, what is a schizoaffective disorder? Many people, and they have an exacerbation of that's where they go to the hospital. So that's just what it is. They have, mood disturbance, bipolar disorder, or depression with features of schizophrenic behavior. And that's why Laurel wrote a good email, but I'm sure everybody's thinking this is why the medications overlap so much, because you can have, a mood disorder, depression, bipolar disorder, but if it has psychotic features, then you're gonna need the meds to treat those psychotic features to get it under control. And if it gets really bad, then they need a benzodiazepine, whether it's short or long term, again, for management. So, the mildest form would be schizotypal personality, and the most too severe are schizoaffective and then schizophrenia. So, multiple causal factors, which is nice to know. And thinking back to Miss Austin's lecture, things she talked about were that make people have mental health disorders. Trauma, genetics, environment.
Definitely drugs and alcohol.
Yeah, substance use,
Yeah.
even nutrition, and then your economic. I hate to say, but if you're poor, you're crazy, and if you're rich, you're eccentric. Truly, but nobody cares if you're really rich. And plus, if you're wealthy, and even you're not even wealthy, but if you can afford the medications, you're in much better shape than if you really can't afford the medications.
Isn't it, it's true that a lot of like mentally ill end up being homeless and they end up going to like ERs for help with like food, baths, things like that, but they can't really afford their meds, so they'll be discharged.
Right, but just like Ms. Austin, I forget whether it was Ms. Austin or Ms. Schrager said, a lot of patients who frequent the ER, I don't want to sound pejorative, I'm going by my experience, they are have problems with substance abuse, like on top of, usually having some schizoaffective type of disorder. Because unfortunately, truly schizophrenic people are so sad, like they don't even know, they don't come in to seek care, manipulate the system, because they can't, like.
But a lot of people with mental illness, they treat themselves with
Yeah, drugs,
like
yeah,
illegal substances
exactly.
or alcohol because they can't afford them.
Yeah, or seriously, like, they're trying to quiet down the voices, like they have voices in their head and bad thoughts. So, multifaceted approach for effective treatment, so those two blanks, what are the mainstays here? We want Brittany, Rob, I know, I'm gonna repeat it. What are the two mainstays of treatment for mental health, or really any kind of health?
What are the main stages?
Yeah, like what are the two big important concepts in mental health treatment?
Therapeutic communication.
Yeah, therapeutic communication, some type of therapy, like cognitive behavioral therapy, behavioral therapy, and
Medication.
yeah, medications. It might go to maybe it might just be therapy. Some people just be okay with therapy, but it's never just medications. Like you need medications with therapy. And then, really the best is both together. Usually greatest effect is therapy plus medications. And multifaceted meaning, psychiatrists, therapists, case managers. So high suicidality though with schizophrenia. And unfortunately, it just gets to be just overwhelmed. So, it's kind of a stereotype that they're gonna, you always screen people for homicidal ideations too, but suicidality is a much bigger risk. So, and this is, chronic illness that, sadly, once somebody has a psychotic break, it's rare that they get back to their pre-morbid condition. So that condition where they were just healthy and functioning, just really sad.
Get it, girl.
My eyes are tearing today, so I'm not actively crying. Don't be sad. So, again, the schizophrenia is going to be three things: disturbances in thought processes, in perception, so how they perceive the world and how they feel like the world perceives them, so not based on reality, and their affect. So when we hear the term affect, you always think of emotion, like my emotional presentation. So affect, external observable emotional reactions, the book definition.
So like emotional present, like manic or depressive?
Well, affect is kind of like whatever your presentation is here and now, whereas mood is longer lasting.
Okay.
So like affect is, tell you a joke, I'm laughing, but I don't have to be in a happy mood all the time. Affect is kind of just like here now. Yeah, flat affect means, no emotion externally. But big definition on page 341 of psychosis. So that's disorganized thinking, decreased social function, and distorted reality, which is really just what I said. But the book definition is right on page 341. So nice to know, it's 1% worldwide, but we live in a densely populated area, meaning, just the whole Pennsylvania, New Jersey, Philadelphia, Pennsylvania, New Jersey, Delaware area. So we're gonna see more people with schizophrenia than we would in a more rural setting, perhaps, per se. So this 1% struck me as a little bit low, because I see people all the time. This is important. So average age of onset. So typically late adolescence and early 20s for men, can be a little bit later for women. So late 20s and early 30s. Then there sadly can be children, very early, before 17, and early, like early onset would be in their, before 17, and very early would be actual children, like before age 10. And again, some of these images are just burned into my brain. Like, I remember one time I was working at Germantown Hospital was open, and the police brought in this little 8-year-old in shackles, like hands and feet, because he was trying to stab his mother. He was actively psychotic.
There's a TV show about two siblings who had schizophrenia. The one was, they didn't have the second baby for a long time, because the first one was really bad, and it's still just really hard.
Yeah, it's awful. But what makes it so sad is, when you think about it, late adolescence, early 20s, late 20s, this is just when adults are it's really when you're finally becoming your own person, like you should be starting your life. And it's common for people coming into the ER having their first psychotic break, and you kind of think unfortunately I don't know because we don't see them afterward, but it just kind of sets up that this is going to be what their life is. And their family comes in, and it's kind of like now your family's going to be having to care for you for your whole life. And it can be people who are extremely smart. Like when I worked at Hub, I hate to, I want to dime them out, but Penn students would come in frequently with psychotic features because they're so smart, but at the same time they're so messed up. And I was something I said, better to be poor, really. They had a lot of psychological issues, for Penn students. When they weren't getting on your nerves, they were a lot of psychological issues. So that's sad. And then there's 4 phases of development, which are more nice to know, but you can see how, especially the first 2 could get by you. So phase 1, pre-morbid phase. So think of those things: shy, grades drop, irritable, sleep problems. What all could that be in somebody's adolescence?
Insomnia?
Depression?
Could be depression, could be being a teenager, like all that stuff. That could just be teenage behavior, which unfortunately, you can't think. You go home like, oh my God, my kid said, you might be thinking anything's wrong. But when it's persistent, so increasing isolation, withdrawing from others, and increasing unusual thoughts is, more worrisome or problematic. Oh, yeah. We're supposed to have it signed it twice. I told them we were doing that, but.
I know. Jesus Christ. Hold that carrot over the head.
So, but pre-morbid in general just means what? Pre-morbid is before the illness happens. And prodromal, so heard that word before too. Prodromal is, really truly before the beginning, but early stages. So again, you can last up to a few years. I mean, that really probably is on the longer side. But here, you know, they're really not functioning well, really withdrawing, you know, self-care deficit, you know, not eating, not bathing. Perceptual abnormalities, so they're having hallucinations or illusions, which we'll get to the difference in those. Ideas of reference, so that means they think, you know, they're controlling things by their thoughts, people are controlling their thoughts, and they might say things like that. So clearly, that's not a normal milestone of adolescence. Like, yeah, you can be suspicious of your parents, but you're not suspicious that they're controlling your thoughts. Right? Yeah, trust me. So, you know, and extremely suspicious, and that's really gonna be onset of psychosis. So phase 3, so here's the active phase, and this is right from the DSM here. So the psychotic symptoms are present, and just like any, you know, chronic illness, it's gonna be long, at least 6 months of these symptoms. So, though it's gonna come up again, delusions are false fixed beliefs. We're gonna just write it down one time and then we'll get back to it. Hallucinations means that you're seeing, hearing, smelling, you know, depending on what type of hallucination it is, that truly aren't there. Disorganized speech, so there's various disorganized speech patterns. They can have, you know, we'll get to all the terms, but things like word salad, where they string words together, they make no sense, or their speech is very rambling. So disorganized or catatonic behavior, so we're gonna talk about these catatonic states of behavior, you know, different waxy flexibility is one. Well, I'm sorry, I have highlighted here for us, page 342 in your text, about the pre-morbid phase. Oh, I just think I was saying, in your book, that's where the phases are, just 342 to 345. So it's right on that. And then negative symptoms. So negative symptoms means that you're withdrawing from normal behaviors. Positive symptoms mean you're imagining or hearing things that aren't there. Negative symptoms means you're withdrawing from things, like very isolated, no emotional expression. So not just flat, but you know, no emotional expression. Avolition means you can't complete tasks. So also important about the active phase, besides that time period, is to rule out other things that could be going on. So make sure it's not an adverse effect of a medication or a med interaction of medications they might be on. That they're not using drugs of abuse. So whether it's that you know it or don't know it, because people can be using drugs you don't know. And that they don't fall onto the autism spectrum. Now, certainly you could be autistic and unfortunately have schizophrenia too, but again, it's gonna be categorized differently if you're autistic. So rule out those things, and you still have those symptoms, then gonna get diagnosed. But yeah, we're not diagnosing them, we're just treating the symptoms, that's what therapists do.
I have a question.
Yes.
So is 1 through 4 positive, or does the first two?
Any two of those symptoms would diagnose you as schizophrenia.
But are they considered the positive symptoms, or
No, positive symptoms are,
just the first two, right?
yeah, well, really positive symptoms are categorized as a catatonic behavior. So the delusions, hallucinations, they are catatonic behavior, because there's other behaviors that could be too.
Okay.
So we'll get to all of them, don't worry. So catatonic behavior in general just means that have decreased reactivity to the environment. If you're not reacting to the environment how you should be. And it can take various forms. Like I said, don't worry, we're not gonna ask you to directly diagnose schizophrenia. You'll know. You'll know when they happen. And then phase 4 residual, so they're gonna go back, again, to symptoms of the prodromal phase, meaning they're not as active and apparent symptoms that they have. So this is, we kind of want people to try and get back to where they were functioning, residual phase. And not to worry, this really is just book stuff, these phases, it's not. I think these.
Should we know the phases for a test?
I'm being honest with you, I think ATI will talk about them, but it's pretty clear, like, you'll
Okay.
know active schizophrenia, the active phase where they're gonna have, true signs of schizophrenia, and the other phases just aren't.
Okay.
And I think these haven't been working right. Probably you have to look at these at home. I'm sorry, if they're not working. Did anybody ever see this movie? How was it?
Yeah.
The guy, he was a mathematician, right?
A real people, like a real person.
Yeah. He's still alive?
No, he was like, died in a fire accident.
Oh my
No,
God.
not long ago, roughly a year.
Nice.
They like were divorced and they got back together.
Oh God.
That's a sign.
Yeah, John, I did look it up. 'Cause I like to. 'cause
They
I'm
were divorcing,
morbid. I
and
always
they
like
were
to see
starting to get
like
back
famous
together.
people with schizophrenia. So of them, what was Abraham Lincoln's wife? They think she had schizophrenia. There wasn't anybody around to diagnose her. And they definitely mentioned that guy. Somebody in Pink Floyd has schizophrenia, living with schizophrenia. Donny Hathaway, singer, who actually did commit suicide. And he's hallucinating right before he jumped out of a building. Okay, so causes, this is more nice to know, it's things we've already talked about, so combination you think, because I hate to say it, but there's nothing health promotion wise we can really control. Yeah, we want people to have better nutrition, but frankly, you can't do anything about your genetic makeup. So really, and we want people to be healthy and avoid viruses, but not much you can do. But the bigger point is altered brain structure is going to affect neurotransmitter and neural circuitry, because all of the medication, all of the pharmacologic agents work on altering neurotransmitters. So interesting thing, it'll say through your book, like if you were born in the winter time and starvation during pregnancy, more nice too. So this is a big one because again and again the meds talk about dopamine blockade. Dopamine blockade is part of the medication. So excess dopamine produces positive symptoms of schizophrenia. So positive symptoms meaning seeing, hearing things that aren't there, believing things that aren't accurate. And this dopamine levels in the vagal striatum, part of your brain that affects movement, so you can have abnormal movements with schizophrenia. The decreased activity of dopamine antagonists, that's going to, when you kids with the class, you kids without them. Those are going to be the hallucinations and illusions. When if I have decreased activity of the antagonists, again, that means I have extra dopamine around. And then faulty GABA system. So GABA, again, has to do with what? GABA is important for relaxation. So if I have a faulty GABA system, then I'm gonna have excitation. What class of medications you already talk about that affects GABA? The drug class?
No.
Yeah.
Benzos, yeah.
Benzodiazepines,
Yeah.
exactly. So again, these other neurotransmitters, can we talk, they are right on. Ooh. I don't have that written. I think I wrote that in accident. No, I didn't, ahead of myself. So if you just wanna go back and look, these are right on page 23 through 27. Talks about the different neurotransmitters. We don't really have to. Because the two big ones we're gonna be worried about with schizophrenia are norepinephrine. Many times there's excess norepinephrine. You think norepinephrine's stress hormone keeps you agitated. And there's a deficiency of glutamate. So glutamate is important for cognition, so thinking clearly. So if I have a deficiency of glutamate, that's how I can have the cognitive problems. But all of these neurotransmitters can possibly be involved. So like I already said, unlikely they're gonna be back to their full functioning before they got ill. Things that have a better prognosis isn't obviously, this is like with any disease, if you were doing well before you got the illness, the later in age you get it, because again, later in age you get it, the longer you're gonna be suffering the symptoms. Being female, if it was precipitated by a stressful event, because if it was due to stress or trauma, just like Keisha said, perhaps if you can work through that trauma, that's gonna help out. Now this sounds odd, if you have an associated mood disturbance, so if you have something like anxiety, depression, bipolar disorder, again, if you kind of get that under control, it's like you're gonna have the schizophrenic symptoms under control too. But that's why in severe forms of mood disorders that we use antipsychotic agents sometimes. So common sense thinking, if the active phase symptoms just have a brief duration, it's gonna be a better prognosis. So if I don't have really many residual symptoms, clearly if I have absent structural brain abnormalities, and that just means, again, we are gonna be working the person up to make sure it's not what? Like this bizarre behavior could be
Electrolyte imbalance or TBI.
Exactly right, so kind of electrolyte imbalance, brain tumor, an endocrine problem, hypo or hyperthyroidism. There's a lot of medical conditions that look like psychosis and it's not. So that's why it's so important to medically clear people and investigate it, because this is not nice to say either. I have to keep it good for a second, but I'm gonna say it in a mean way, but crazy people get sick, like they get medically ill. Doesn't mean that don't not have mental illness anymore, and people discount their symptoms. So, and then no family history of schizophrenia, of course, is any better. So here we go. Positive, negative symptoms. This is a big one. Big important slide. Triple star this guy. This is a lovely table right on page 351 of your text. Box 15-2. So positive symptoms. I'm sorry for yours. Can you turn the light for me? My old eyes, between my eye tear and can you turn it on?
The other one.
Thank you, because I'm sorry, I really can't see. This makes me too drowsy. Positive symptoms are going to be, again, manifestations of things not normally present. So alteration or distortion of mental function. Those are positive things, positive symptoms. Distortion of mental function
It was a manifestation of things that what?
that aren't normally present. So you're seeing things, they're not there. Negative symptoms means loss of normal function. So it is absence of things that are not normally present. Because I was last week, I mean, I'm sure I just forgot I knew what they meant, but I forgot why they called them that, so. Learning every day here at the Rocks. So positive means you're seeing, perceiving things that aren't there. Negative means you lost some of your normal function. Cognitive symptoms, that's problems thinking, problem solving, problems with your memory, decision making. And then affective symptoms, so there's things, hopelessness and suicidal ideation that are unfortunately common in the mood disorder of depression, but happens with schizophrenia also. Suicidal ideation.
And the cognitive is just trouble thinking and decision making, problems
Yeah.
decision making?
Problem solving, decision making, trouble with your memory.
I missed the lines next to the slide.
What's the?
I missed the lines next to the slides.
Oh, did I? Oh, because I think we're supposed to do it 6 per page now or something. There's always a new rule every day we come to work.
That's a rule, these people.
I thought it looked weird. Next time I'll do it. I'll do it. Right.
Pretty soon you're going to have to print out your own paper.
Okay, so positive symptoms. So your book just breaks these down into different little categories. You don't have to worry about the categories. They're sort of helpful to help you study them. So delusions, that's a false personal belief. I have a delusion about myself. I'm a ballerina for the Pennsylvania Ballet. No, Religiosity, so that's a popular, I hate to say not popular, but common one. So excessive demonstration or obsession with religious ideas and behavior. So just you're obsessed with religious ideas and behavior. You hear the person screaming on the sidewalk about Jesus and common religiosity. So this, I should not make a joke, but you don't have to make a joke. In my family, I don't have anybody with schizophrenia that I know of, but like a couple of my friends do have family members with schizophrenia. So my one friend, and it's so sad, I only bring up because her father just died and her brother was hospitalized for schizophrenia, that he thought he was St. Francis of Assisi. And he dressed in all white and grew his hair really long and a beard and like would carry around animals, stuffed animals with them. And it started out, it was so sad because a couple of years before that, he had gone to a Halloween party. We thought he was as St. Francis, but never, it was years later, and then he had to go to the hospital because it just got to be too much. And I only bring up because, sadly her father just died. And they put up pictures and here he is all kind of, his hair is back long again, and probably gonna put it into something sad. So paranoid, we all probably know what that is, extremely suspicious, like me here. Magical thinking, so that's when you think that, your thoughts and ideas are really influencing behavior. Just like, you know, when we talk about children, like, I wanted to be hot outside, now it's hot outside. It is me, I'm that powerful that I need a hot outside.
What was the definition of right? I'm sorry.
So magical thinking is just ideas that your own thoughts or behaviors are controlling the external environment.
Okay.
It's just like we talked about when, you know, we talked about grief, and, you know, children will think somebody died because they were bad, or, you know, their parents got divorced because they were bad. Not true.
Is paranoia like, because of that, like, ideas of reference, is that idea?
Your book doesn't classify as that, your book has different things for ideas of reference, they just have content of thought for, but I'm sure if you went to another source, it would say something different. And like I said, this, you know, it's helpful to study this way, but you don't have to, it's not gonna be a question like, oh, what's what's a content of thought one? This talks about them overall. So here's ideas of reference, meaning, you know, the person's a reference point. So persecution, so people are after me, people are trying to get me, people are trying to kill me. Grandiosity means, you know, you think you're the king of the world, queen of the world. Somatic sensations, so that's when you think things are crawling under your skin or crawling on you. So again, here's one, like, investigate that. Like, maybe they could have some infestation, like they could have lights, like, not necessarily that they're having some mental illness. You always have to investigate it. So throughout broadcasting, that means, you know, I'm transmitting my thoughts to other people. Thought insertion, so that's a common, like, oh yeah, they implanted an electrode into my brain at the gas company. Now they can all get all my thoughts. So delusion of being controlled, like other people are controlling you. And nihilistic, so that means that either, you know, a part of your body's absent, or like, you know, somebody took my heart out of my chest. Like, my heart is not there anymore. That's nihilistic. So then, form of thought. So loose associations. So you're really shifting from one idea to another, like just kind of conversation is disjointed. Neologisms means that you're making up words that only have meaning to you. You know, commonly they tell you it's a secret, like, or something like, you know, they'll tell you like it's, and they're dead serious. Concrete thinking, so statements like, I'm gonna take your blood pressure. And, you know, no joke, well, where are you taking it? You know, she said she's gonna take my blood pressure, I can't be over there, she's gonna take something from me. Just, again, like children, you know, would think.
Being literal, yeah.
Yes.
Yeah.
Mm-hmm. Clang association, so I think this is like, you know, rapping kind of, like, you know, you're just block, 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 block. But people, you really will hear people with schizophrenia doing things, so they rhyme their words. And word salad means, again, random words don't have any association to each other. Loose associations, they really are like, have a little bit of connection, but word salad means they're not having any connection. And again, don't get stuck, it's not like in real life you're gonna have to document what was word salad versus loose association. You get say things like rambling speech, disjointed speech, disorganized speech. People would get it. Same thing, so circumstantiality means, you know, they really have rambling speech. They're finally getting to the point, but, you know, killing you with detail. Compared to tangentiality is they can't get to the point at all. And these two happen also in manic phases. So if somebody is in a manic phase of, you know, bipolar disorder. Mutism, easy one, that means, you know, now I've stopped talking. Poverty of speech also is called. And perseveration, that means, you know, you keep saying the same word or asking the same question over and over, no matter what you ask them, or, you know. Commonly, people with dementia will do this too, perseverate, like they'll, you know, have the same response or same question. So point about that one, and it can also happen with head injury, is like not to lose patience with the person, like they literally will ask you the same, or you're gonna have the same response, same question 30 times in a row. They can hear your tone if you're, getting impatient with them, so you have to just kind of keep answering the same tone, because they can hear that you're getting more frustrated or anxious, and that's gonna make them more anxious. So echolalia, they actually have that in your book here.
That's the,
I think ATI had it one place and your text has it in a different place. But that just means you repeat things that you hear from other people. And it's because your sense of self is so lost that you're trying to cling on to somebody else. So you just repeat things that you hear. So here we go. Hallucination is a perception when there's no external stimuli present. So your, taste, so gustatory taste, auditory is hearing, visual seeing, olfactory is smelling things, and tactile, again, is, if you feel something happening to you. The, most common and worrisome one are auditory hallucinations. So false perception of sound, and typically, the person, hears things, someone's shouting, cursing, saying negative things in their head. So far more often it's, directed to the person. Sometimes it will be, command hallucination to hurt somebody else, but far more often is to hurt yourself.
Question, I had a patient one time that, had musical ears or something like that, like he always kept hearing music playing and music playing. Does that kind of categorize it with this or just?
Yeah, but it could be some neurological disorder too, but that.
But that's what I thought it was, he seems like
Right, because you can hear music as an auditory hallucination, but there's plenty of, that's what's so, fascinating and frightening about the brain. Like, there's so many things that are, legitimately happen, that are organic problems. So it's not always just, never discount anything that they just have mental illness. And then, nice to know, so tactile is called fornication. So it's not fornication. Fornication means doing the nasty. Formication is how you feel like things are crawling underneath your skin. Oh, that was fun. Compared to an illusion, so an illusion means you see something but you're not perceiving it properly. So like, I see that person's two eyes back there looking at me, so it's the eyes, it's the electrical sockets. But think if I'm having an acute psychotic episode, I would think those are people looking at me. That's an illusion's kind of easy to see. An illusion, again, that's another one when Ms. Reynolds talks about cognitive issues and delirium, common for people, even when you think, my eyes are bad because I'm old, but you get up early in the morning, you're like, is that what's over there in that corner? Like, that's an illusion.
So it's something that's there, but you're perceiving it differently.
Exactly. Like, you're looking at the wall, oh, look at all those bumps in the wall. Well, it's just, it's little holes because of the cement, but one can see, like, even if you were some, even opioid, how you might think that was for insects.
it's kind of like the same thing as visual hallucinations, though, right?
No, so hallucination means it's not there. It's
Oh,
not
okay, so you perceive it as, okay. So.
Yeah. Illusion means you're just not perceiving, something's there, but you're just not seeing it you're just not seeing for what it is, where a hallucination is, I see a bear sitting right here. Then for sense of self, yeah, I can't see my eye keeps hearing. That echolalia means that you're again repeating speech, and that's just because you have such a distorted image of yourself. You just try to repeat things that you hear. Echopraxia means that you're repeating movements. pretending like you're cooking something, pretending like you're cutting somebody's hair. Identification, imitation, that means you could be mirroring somebody's body movements. And depersonalization, that, you know, you're no longer a person. Again, really close to that nihilism, but you're just, I'm not anybody, I'm nobody. I'm not here, I'm invisible. And then more, so going to negative ones now. So remember, negative means what? Now something that should be there is now gone, now missing. So affect is our emotional, you know, our outward emotional expression. And volition just means some goal-directed activity. So flat affect means, again, you don't really have any emotion, happy, sad, mad. It's just always blank. Inappropriate would be, again, someone told you sad news and you start laughing. Apathy is indifference or disinterest really in everything.